Hi, everyone, and welcome to our episode 3 of our three-part podcast series, Racial Equity in the Fight Against COVID-19. We hope you have enjoyed our last two episodes and were able to benefit from the valuable insight provided by our guests. Once again, our project titled Racial Equity in the Fight Against COVID-19 aims to demonstrate the importance of collecting race-based COVID-19 data in order to ensure an equitable response to the current pandemic, particularly for Black communities. Here joined with us today is Waleed. We will be discussing the comparisons of low-income neighborhoods in the US and Canada, as well as final steps that can be taken to alleviate the effects of the pandemic on the marginalized communities. And lastly, the lessons the Canadian government can take moving forward. Our special guest today for today's episode is Mr. Liben Gebremiakel, who is the Executive Director of TAIBU Community Health Center. He'll be providing us with his unique insight on the comparisons of low-income neighborhoods and the next steps/lessons the Canadian government can take from this pandemic. Thank you for being with us today.
Thank you for the invitation. Appreciate it.
So to start off, we want to highlight how statistics have shown that COVID-19 has continually affected disproportionately low-income Black communities in the United States and Canada. So our first question is, what are some similarities in low-income US communities, for example, communities in the New York City or any other city in America, that you have noticed in the low-income communities in Toronto? And how important is that the collection of race-based data be collected?
So thank you very much for that question. When we started getting information from the United States, it was very clear that certain communities were being impacted disproportionately because of the COVID-19 situation. And these communities were the Black communities and racialized communities, indigenous communities, and people who are living in low-income neighborhoods, right? At the time, we didn't have any clue or information of what was happening here in Canada, or at least in Toronto or the GTA for us. But we knew that the picture would not be any different from what was happening in the US, because this is a health issue, the health situation, and we know, from previous information that we have that the Black community, racialized communities, and low-income neighborhoods are always disproportionately impacted by health crisis, by chronic disease, by mental health, and by other social determinants of health. So we knew that would be the case, and a few Black health leaders in the city of Toronto and the Greater Toronto area really started advocating for the need to start the collection of race-based data. Collection of race-based data overall for health and social, measuring social and health outcomes has been there, and we've been advocating to get that because it doesn't happen a lot in Canada compared to other countries, for example, United States or the UK, right? So we've been saying this, but when COVID hit, we really wanted to make sure that at least we would start collecting information as it relates to the COVID-19 situation. And so through the advocacy that the Black health leaders and the community played, the city of Toronto agreed to start collecting race-based data with regard to COVID-19 cases, incidences, and neighborhoods. And so with the report that has come out quite recently, I think a couple of weeks ago, we can really see how disproportionate the impact of COVID is for marginalized low-income neighborhoods and racialized communities, right? So, it's not different, it's the same. And what that tells us is there is an underlying systemic issue that leads racialized communities like the Black community or indigenous communities, marginalized communities, and communities living in low-income neighborhoods are impacted by this, and we call it anti-Black racism, right? Or anti-racism generally, but particularly with the Black community, anti-Black racism. And because the system has not really, is not, has not done a lot of work around equity, any health or social income or social status issue would impact certain communities more than others.
Thank you for your response. That is very true, everything you said. So we'd move on to the next question now.
Yeah, so next we would like to ask specifically, how has Canada's government response to COVID-19, for example, opening the stages, closing borders, limiting access to stores, etc., impacted the Black community specifically?
So if I may start by looking at the general response or the response of the Canadian government, the provincial government, and the municipal government as it relates to COVID, I think the measures that have been taken are to be commended, because we can see how the COVID curve has played in Canada, in province, and in the city of Toronto compared to other cities. So I think the government, both provincial, federal, and municipal, have to be commended for the quick response and strict response that they put out, whether it is the closing measures, the social distancing, the then looking and studying and opening things in stages. I think that has played a significant role in limiting the impact of COVID in general, right? So I think that is one piece that we really need to commend all governments, all level of government for having done that. And within that, it would also show that that kind of a protection and prevention has helped racialized communities and Black communities. I think where the gap is not having very specific and community-specific responses to certain population. And I think that is where the question or the issue of equity comes, right? You can't deal with everybody the same way, because not everybody is at the same level. Not everybody has privileges and opportunities and access and things like that. So I think if there could have been a more specific, community-specific responses also included in that, that would have been, we would have not seen the number of cases, for example, within the Black community, which is higher than any other racialized communities, right? The last report, for example, I think was showing that the Black community cases within the Black community was 21% compared to their population, which is about 9% for Toronto. But other communities were lower than that, right? So if there was a specific plan, strategy to deal with those communities, Indigenous, Black, who, people in low-income neighborhoods, then we could have really had a better result or a better outcome. So I think that is the issue of equity, right? This is not just for COVID. This is for every kind of situation that we face. We need a specific and separate specific strategy or plan or action, or even resources, right? So for example, when we look at the number of cases, the number of deaths due to COVID, the number of employees that have been impacted by COVID, you will find that it's disproportionately higher for Black communities, racialized communities. Why? Probably it's the kind of employment they're engaged with. It's probably poverty and maybe the need that they have to go to work and not be able to work from home, right? So for example, one of the measures that was taken by the government was, okay, limit the number of people in your offices, let people work from home, right? That is a good plan, okay? So people started working from home, so there's less traveling, there's less contact, so that creates social distancing. But a lot of the marginalized communities, and particularly Black communities, are in employment that will not allow them to work from home, right? Whether it's social services, hospitality, healthcare, right? PSWs and stuff like that predominantly are from racialized and marginalized communities. And so they wouldn't be able to work from home. They would have to go to work. And if they have to go to work, they may not be able to drive, so they have to use public transit, which again exposes them to all the risks that the government is trying to reduce. So when there is a plan, it is very important to look at where is everybody, who are the most impacted, who are the most at risk, and what kind of protection or plan do we need to do that. I think if that would be something that would be very comprehensive in terms of a strategy or a plan to address situations like this.
Yeah, it's very interesting that you note that the government should have made a community-specific plan. I think that's been noted in the last two podcasts as well. It seems to be a very common complaint or advice for the government from a lot of people.
Yeah.
So yeah.
So yeah, once again, thank you for that response. So moving on to the next question. Has a governmental aid system been beneficial to the Black communities? What would you want to change about the procedures taken when provided aid? Like, for example, for CESP and CERB, what would you want to change for that? And lastly, how could the government have provided a more equitable response? I know you already talked about this in the last question. So just for the first part, you could.
Right. I think, again, those are the kind of things that we need to think about, right? So not everybody is the same, not everybody at the same level, not everybody can access information the same way, right? So when there are information like this, when there are support like this, when there is assistance like this, how to make sure that kind of information, that kind of access, that kind of a support is meeting the needs of the most marginalized? Because if you plan things with the most marginalized in mind, the response or any system or any plan you develop would be okay for everybody, because you would have covered the it's going to be from bottom up, right? So I think with regard to the assistance that was provided by the government and financial aid, I think this is great, right? I think this is commendable. But how were everybody able to access that assistance at the right time, in the right way, would be a question, right? Because how you get information, how you access services, how you access support is different from different communities, right? So that is something that, as we talked earlier on, there should be some specific plan or access routes for those marginalized communities. The other thing I would say is we have a lot of racialized, marginalized, and communities in low income that their employment situation is so precarious that would not allow for people to be able to access this kind of financial assistance, whether it is EI, whether it is CARB, because you have to demonstrate that you were working and you lost your job, right? So if you are in a situation where, like most, quite a lot of our racialized populations are doing precarious employment, then you won't have access to this kind of information or assistance. And so what happens to those people? And those people are already at the bottom of all kind of challenges. And so with no appropriate resources and assistance, they will be impacted even more than other communities. So those are some specific issues. You have uninsured community members who are here, because of some immigration issue, like things like that are not accessing all these services, and they're always at risk for health or for social assistance, and those people are not able to access those programs or assistances. So that's why when a plan is designed, when assistance is provided, we also should pay attention to the most marginalized, the ones that don't access information or services in the traditional way of going and applying online. If you don't have internet access, if you don't have capacity of laptop or computer, how can you do that, right? You will need somebody to help you go through that. Even if you would qualify for that assistance, there are some other technical issues. And we saw this during the COVID, right? Even with school being closed and education moving onto an online platform, not everybody was able to follow education appropriately. Number one is a complete shift for parents to be able to do that. And if you don't have good enough internet access or laptop or computers, I know the TDSB did provide some assistance there, but it's very limited to what they can do. So,
Exactly.
right? So those are the kind of things that, like not everybody, like, okay, there is CRB, great. Not everybody can apply for that, right? You would need to find the information first, right? If, and if you're not there with information, you don't know. You need to have all those digital access points. And if you don't have that, then you're always struggling, right? So the link low income communities, newcomers, immigrant population, which are predominantly racialized and predominantly Black and indigenous, would have challenges in accessing those services.
Yes, that's very true. So a point to like talk about what you mentioned is earlier in our research, we talked to Black Creek Health Center, and we'd like to like commend all these community health centers who actually are trying to help the people who don't have access to technology to apply for CESB and CERB, because we know that when talking to one of the executives at Black Creek Health Center, they are reaching out to the community members and helping them apply to CESB and CERB. They're providing them with resources. So I feel like that's all amazing. Like the community health centers are doing that, but there should be like additional assistance because they can't reach out to everyone, right? There's a lot of people in the community. So I feel like government should make additional committees or additional assistances that can focus on these marginalized communities that don't have technology available, don't have these other resources available that are necessary for like life and for everything else. So yeah, another recommendation for the government is we've like lived through this pandemic. I mean, it's still going on, but stages are opening up, but they could like have committees that focus on just marginalized communities and how to tackle the responses and approaches for those marginalized communities. Because of course the government as a whole did a good job, you could say, in providing CESB, in opening up in stages, in providing CERB, EI, and all that stuff. But that was more of a blanket approach, which we talked about in podcast number 1. And that's how you like cover almost everyone, right? But there are like specific things you need to cover, which are the marginalized communities. And in the blanket approach, they're not covered as well. So I'd say that government can look forward to making committees for future pandemics. And even for this pandemic, they could try it out, create committees for marginalized communities. And yeah, so I'd like to commend
I
like
think
all these community health centers.
If I could add there, like when you started your introduction, you talked about the need for race-based data collection and analysis, right? So this is where these, the collection of the data becomes very important. If we can collect data based on the different communities, marginalized, racialized, then we have evidence to demonstrate that certain planning processes should change, right? Because you can say, oh, we've spent so much money and we've helped so many people, but the statistics and the data will tell you, or should tell you, that not everybody benefited the same way, right? So if COVID is impacting more certain communities, then more focus, more effort, more resources should be applied to those because you need more to talk to them. I know, we're going to be talking about how do we do recovery. It's the same thing, right? When we're talking about now opening in small stages, recovery situations and recovery support, usually, like the majority of the people who are doing okay were at this level before COVID, and they went down maybe a couple of steps because of what has happened. And they only need a couple of steps to come back to where they were, which is a good space. But marginalized communities and racialized and low-income communities were below here, and now they've gone 4 steps downwards. So now if we need to think about recovery, we have to think about those 4 steps that they've gone down and the previous 2 steps that they were also below that, right? So the effort has to be doubled for racialized communities because they were not doing well before COVID. They got worse. And now when we're thinking about recovery, we need to do more for them so that at least they are in a better place than they were before. So those kind of data measurement can give us access to negotiate or to demonstrate to the government to say, here is what COVID told us, and here is what needs to happen, and here is how much effort we need to put in for this particular section or for that particular section, right? Even within the racialized communities, we may have diverse population within there, right? We may have new immigrants who may have suffered even more than other people. We have those francophones because of different situations. We have LGBTQ communities, right? So we have, so different diverse communities within that also can tell us who was impacted more and who needs help more. All right.
Exactly. So we're going to move on to question number 4 now from Walid.
Yep.
Yeah, so do you feel that there is a common complaint or a prevalent issue in the community you are involved in that hasn't been addressed by the government yet?
I think the government has been listening, right? And I think, there are some things that were not very, very at the forefront for discussions. Housing situation, for example, which is a difficult situation for a lot of marginalized communities. And it was only later on that people started talking about housing and what kind of assistance is required. But housing is a big issue because we already have a large number of people who are being impacted by homelessness. And so the COVID situation has made that worse. And I don't think there was a strong plan and a strategy to address that issue. I think the other issue that in my opinion, did not also get the highest attention of all was some of the what we call the migrant workers who are doing a lot of agricultural work out there, who don't have a lot of access and are not connected to systems as such, and have been impacted more by COVID situation. I think there hasn't been a lot of conversation, even though there has been some conversation within the Black community, but prison population, right? Prison population and COVID, I think should also have gotten better attention and quicker attention, both in terms of management, but more so in terms of prevention, right? And we know the prison population is disproportionately represented by the Black and indigenous communities. So I think there are some pockets of areas where not enough or significant attention has been given. And I think it started afterwards, but there was a lag. And I think with COVID, because COVID hit, and if you didn't have any plan in place, like shutting down or closing the border, right? Those are the kind of things that really helped with COVID situation, right? If you were a little more lag in addressing it, a lot of people would have been impacted by the COVID situation. And I think that is something that may, again, if we had an equity plan overall, right? Where we believed, and we had evidences where we believed that certain racialized and marginalized and low-income communities are always at the bottom, whether it's health, whether it's social, whether it's education, whether it's employment, whether it's criminal justice. If you look at all stats, these communities are at the bottom. And if we knew that, and we really work with that kind of a frame of mind, when a pandemic comes, when there is a particular issue, that's where you would start and say, okay, our plan should start from there. We don't have that in Canada yet. And I think maybe pandemic situation has highlighted that. It has amplified it, and now people are able to see the impact of it. So maybe moving forward, we can continue to improve in how we are developing plans and making interruptions. Somebody said one time, I think what COVID is COVID is like an X-ray, right? You would know something was wrong, but now the X-ray is actually showing you your bone is broken at this place, and here is how it's broken. Even though you knew, let's say, your bone was broken anyway, but the X-ray will show you exactly how it's broken, where it's broken, and how many pieces. And now you can decide and say, okay, in order to fix this broken bone, you need a certain intervention, a certain strategy, a surgery maybe, whatever it is. So hopefully with this experience of COVID, at least the first phase, and where we're preparing to go into a second phase potentially, I hope not, but when we're doing that, maybe there are some lessons learned that we can say, can we do this differently next time?
Exactly,
Yeah, it's an
exactly.
excellent analogy with the X-ray. One thing that I've heard a lot is with international students, with the confusion in terms of like how it's going to work, at least with like my community.
Yeah,
That's a common complaint or prevalent issue
yeah.
for us. Have you heard a lot about that as well?
I haven't heard a lot about that, but I would agree with you because number one, there was lack of information. They were
Yeah,
confused. You're right. In some cases, people didn't even know where to access support or services, right? Because you wouldn't qualify anywhere if you were an international student, and you would be assumed to be okay, right? So some universities were a little bit more proactive in supporting and providing information, but there was no plan or a strategy to say, as it relates to international students, here is the plan, or here is what you should do. That's very true. That's very true.
thank you for your answer. I think we're gonna go to OJ for the next question.
Yeah. So just a follow-up question. This is not part of the actual questions, but when we were talking to Black Creek Health Center, they talked about finally having access to mobile test clinics. And around the July time, I think it was, or June time, they finally got a mobile testing clinic in their community. So just a question, how have those testing clinics gone in communities? Has your community also got one? And if so, like, how has it been? How's the response from the
Uh,
community and everything?
so not yet. We are working with our partners in our neighborhood here to do similar thing, and we are following the lead of Black Creek Community Health Center, and they're doing a lot of great work in that side of the city. And interestingly, if you look at the COVID map, it really shows you where the most impacted communities are, right? It's Northwest and Scarborough. Those are the two large hotspot areas that where you have a high incidence and cases of COVID. And no wonder Black Creek is really doing all the great things that they're doing. We've started to do that, and we truly believe that is one way of addressing the issue or the disproportionate impact. Number one, I think when it is community led, for example, just like Black Creek, there is a better engagement with the community because Black Creek is known to the community. There is a trust issue, right? We know how to engage our communities better than big institutions who don't have regular relationship and stuff like that. So I think that really works. And it's also some of the discussions that because we talk to each other and we are at different tables and meetings. The other thing also is, as part of that process, there is also the education piece that is very important within racialized communities, because there's a lot of misinformation, disinformation, myth that go along that are not clear, that are not scientifically based. So as community health centers, we play that role of engaging, creating awareness, educating, but also doing all the kind of clinical stuff that needs to be done. And through that process, we're able to reach more people, do the education, the prevention, and also identifying people early and supporting them and linking them to the appropriate support and services that they need. Right. So I think that's a very great model that the Black Creek has been able to start that testing model. And I think it's being expanded to other places. So that's why we are now in communication with our partners in our region to start the same thing.
Thank you. Thank you. That's very true. So next question. So this question is about vaccines. So how long after a vaccine is produced and the disease is eradicated, do you think things will go back to the normal? So
Right.
what is the new normal for individuals in color/Black communities, and how may this be compared to other communities?
So I don't think there's going back to normal. I've been thinking about this, and I think we have a new normal, right? We're not gonna go back to where we were before, particularly in certain areas. I think things have changed for good, right? I'm talking about, for example, how we deliver our programs and services. Some things have significantly changed. I think in terms of it's gonna take a longer period for racialized communities and Black community to get back to a place where at least in quotation mark, things are normal and we are coming back to a place where there's not a lot of anxiety. People are going back to work. Children are going back to school and things like that. But I think for racialized communities, it's going to take longer. Like the analogy I gave you earlier on in terms of like we were below a certain standard and now we're further below. And then so it's going to take us a longer time, double effort, maybe more resources to bring the community back, not back, but at least to a better place than the community was before. So one thing that I've been reflecting a lot recently, since COVID came, was education support for children and young people. Right, we touched upon it earlier on briefly. When COVID hit, school got closed, things moved into online. Right, so if you are middle class, have good equipment and stuff like that, probably nothing has changed much except for location of where you're accessing education. But for most of the racialized communities, low-income communities, where you don't have the capacity, the infrastructure, right? You have a larger family, so you can't even social distance within your own home and stuff like that. And plus the support that children need for education is a challenge. Has been a challenge before, and now is gotten worse. And I'm thinking, and I'm concerned that there are going to be a large number of children and young people who have missed out through proper education support between March and the next term. The next term, when school opens, they're going to progress into the new year or school they're going to go to. But there has been this huge gap where they didn't have a lot of support, right? And that is, I think, a challenge that we're going to have. And we should have, we should work with government to try to get some extra support so that young people are able to catch up and get proper going through that process that they didn't go through, right, when they were online, so that they can be successful moving forward. If you're moving into high school and you've missed a chunk of education, you're going to struggle when you're going to get to high school. Already with racialized communities and education has been a challenge because of the systemic issues. And now that's going to be even worse for them. And so we need to start thinking about putting a system, a support system in place, which we are thinking about doing within our programs that we have for children and youth, is add a component of supporting them through education so that we bring them up to the level where they should be, right? Because otherwise, you're in high school, you're going to start in the wrong way, then you will be streamed and say, oh, you know what, you're not doing well, why don't you just go into vocation and you're not university material, which is already happening anyway for Black students, right? And so we're going to perpetuate the cycle of you're not going to have a good education in high school, you won't progress into post-secondary, so what is your prospect moving forward? So there are some elements of support system that needs to be thought properly, and for the government to come with a plan or resources or work with communities, because there is knowledge and information in the community, there is capacity, technical skills, and money with government. If we can combine the two, whether it's education, whether it's through employment, or whether it is health access, those are the kind of things that I think we should be able to do to improve the situation. You talked about vaccine. And I think vaccine is like any other health services. If already the Black community is challenged in accessing health services because of various reasons, the challenges are going to exist when the vaccine is going to be available, because that's how the system works, right? If you have not changed how the system works, whether it's a vaccine, whether it's a prevention, whether it's seeing a doctor, it's the same thing, because you have to come to a health center in order to access that vaccine. Secondly, I think there's also an issue of how that is going to be communicated and how we're going to reach the people, just like the testing center, right? Not everybody is going to be able to go to the testing center. So are we going to go to the community, find them where they are, and find a way that they are better able to access those vaccines or services would also be very important to consider.
Exactly. You made very good points there. So talking about the school thing, I heard that TDSB, for example, is trying to implement 2 days of in-person school, like with social distancing measures, and they're trying to make it an option to go in school because maybe they did notice that between March and June, the school year, there was not much either involvement, but there's much what's it called, difficulties to be involved within school. So they are trying to implement 2 days of in-person school, but you are right. There are inequities already present before the pandemic, and now when we are in this pandemic, these inequities have been highlighted even more, and we have seen these inequities within these marginalized communities highlighted in from community health centers and through data in specific.
Yeah.
And there should be some either after school programs available in person, of course, or if the government does have funding, and we've seen that the government actually does have funding by providing CESP and CERB and all these other things, they should be providing these marginalized communities with more access to technology,
Yeah.
because technology is like the new normal kind of, because everything we can see, like we'd never imagined that all these like jobs can go online like that, right? Because people like would call in sick days, for example, just to not go into work. But now they've seen that, oh, we can not call in 6 days. We can still make the money and we can work online because it's all accessible now. So going online is kind of the new normal because people are going to be still a bit scared about COVID, even when things a bit die down. It's going to take a couple of years. And for real, like in my opinion, you talked about vaccines and how it won't be accessible to like these communities as much because of already health disparities, but people will not be like settled and going back to normal until like a vaccine is produced, because the disease will still be there.
Right.
And yeah, I feel like it took a pandemic to highlight inequities within these communities, and hopefully the government can make a more equitable response in the future. And once again, I commend all these health community centers like Black Creek, TAIBU, etc., that are doing a lot of work for their community, because it is important. Because if no one voices these concerns, then nothing will happen. If a lot of people voice it, then a lot of people will hear it, a lot of views will happen, and actions will be taken to prevent in the future.
Yeah.
Yeah.
Yeah. We're even meeting online now, right? You would have done this interview somewhere else, physically present and stuff, but here we go.
Exactly.
Yeah.
So now we'll move on to the second last question for today by Waleed.
Yeah, so this question actually relates to what both you and Umar were talking about, with how marginalized communities are going to have issues getting the vaccine because of existing disparities in the healthcare system. So the question is, when a vaccine is available, what protocol do you feel the government should apply when delivering the vaccine to low-income neighborhoods to make sure it's available and accessible to everyone there? So for example, should it be clinics specifically for the vaccines? Should they be available in all health centers, et cetera? What are your thoughts?
Yeah, so I think, as we were talking about earlier on, I think how communities access different services can give us some idea of how we should do the vaccines as well, right? So, having it closer to the community that is accessible, where communities are already present, are going there and are comfortable to go there, would be something very, very important to consider. I think the second thing is also we need to do a lot of education and community engagement around the vaccines, because already there are a lot of misinformation. There's already myth going on. Plus we already know that the Black community particularly does not trust the system, right? And this is, rightly so, because the health system, the government has used health services, including clinical trials and vaccination, all those kind of things, to further marginalize, racialize, and actually kill communities and population. So if I am the government and I'm coming up with a vaccine and I want people to take this vaccine, I need to make them feel comfortable to be doing that. And so there's a lot of information, campaign, awareness, engagement that needs to be part of the vaccine deployment plan, particularly as we talked earlier on in our conversation, specific to certain communities and building relationship, right? So if already we're using the model of community testing and mobile testing units, these people are going to be going out there and knowing people and having a relationship. That would be helpful when the vaccine is coming out, to use the same system and say, okay, we're coming to you and here it is, and we're making it available. You have a choice, you can refuse not to take it or not, but at least we're making it available for you to have access to it, right? So, a lot of times health services are geared higher up in, on the ladder, in institutions and hospitals and things like that. And that's not accessible to communities. So making it very accessible with a proper education, awareness, and engagement with the community will be critical for the vaccines to be effective. And the principle of equity always says, start building up from the bottom, right? And so the plan should actually first pay attention to those equity deserving groups, those who are most marginalized and disproportionately impacted. Start there, right? Just like you would start, for example, if there was a vaccine, you would say, okay, we're going to start with healthcare workers. It makes sense, logic. Okay, right? Good. At the same time, we're also going to start with racialized communities. Which community was the one that was most impacted by COVID? Because if we start there, then we're going to address the most difficult issues. By the time we progress up, we're dealing with the less vulnerable, where there is less risk or less challenges, right? So those kind of shift in their thinking and in their planning would, I think, make some logical sense, but also would be better impactful if you really want to address this issue of intervention and prevention.
Yeah, so that's really, really good advice. Thank you. So we'll move on to the last question. I think, Omar, if you want to take it away.
Okay, so before we move on to the last question, I'd like to say that I really agree with all the points you made. And I feel like, once again, talking about Black Creek, how they made these mobile testing clinics available, it kind of shows that it is possible to do these things. So having these vaccines, once they come out and once they are accessible, don't only put them in major hospitals, because to get to the major hospitals, these marginalized communities, these individuals may not have access, as you said, like may not have vehicles to get there or aren't like close by. So having these clinics opened specifically for vaccines could be very beneficial for these communities. And that's something that the government should look at, because it's very important to deal with things in an equitable response rather than an equal response. So yeah, moving on.
I think that's very good, and I think it should be repeated. And not an equal response, but an equitable response is what you said, Omar. And I think it should be stressed, right? Because usually the plans are always, okay, everybody, we're going to do this. And then you lose a large majority of people who really are not included in that everybody, in that equal plan, right? So thank you for that reminder. I just wanted to highlight it. You just said it like that, and it just, I wanted to make sure that you captured it.
Thank you.
Important point.
So this is going to be the last question of the podcast, and it's basically like a summary question. We've discussed a lot about all this in the podcast and steps to take. So anything you want to add and anything you want to say, you could reply. So what lessons can the Canadian government take from this pandemic? What steps should they take to improve the health outcomes of the Black community moving forward?
So, I mean, this is looking at a very, very high level, right? So I don't know if the Canadian government is actually collecting race-based data as it relates to COVID. I don't know, so I won't say they don't. I know the province had agreed that they would start collecting that. Initially, that was not the plan, but after Toronto Public Health and the City of Toronto took that initiative, I think they also agreed that that should be done. And I think that is that is one of the lessons that I think everybody should pay attention to is, if you really want to change, or if you really want, if you want to change something that is not working, you need to understand how that problem exists, why it exists, and what is the extent of the problem, right? So that's what the race-based data collection and analysis can be used for, to say who's most impacted, who's most affected by this, and why, right? And we know, why the Black communities and racialized communities, indigenous communities, are being impacted by COVID or any other chronic or epidemic situations. It's because of the inequitable and disparities that exist already, whether it is housing, whether it is health, whether it's income, whether it's, they're all related, what we call the social determinants of health, right? And so if we cannot understand that and really know the extent of that problem, then I don't think it will be able to even start to address the issue of inequities within Black communities and racialized communities. So I'm hoping that this is a lesson that is coming out. If COVID has shown, just like we said earlier on, and amplified these inequities, then I think that's where we should pay attention. And, sometimes there is this notion that, a lot of investment is put in around, if it is healthcare, in hospitals, because that's where we see most of the challenges, right? We see a lot of people in hospitals, emergency department visits, right? Seniors who are ending up in hospitals and not coming out, right? All those kind of things. So the government is always addressing at the other end of the healthcare spectrum, right? Or if it is around criminal justice, or we have a lot of people that are going to be going to jail, so let's build more prison, more jails, right? And so they're focusing on the outcome or the end result of a problem, and not trying to say, but where is this problem coming from? Where is the fire starting, right? If you're always trying to put the fire out where the flame is coming, and you really don't understand where the source of that fire is, you will always be, trying to fight the fire and not eliminating the source of the fire, right? So, when you take your first aid course and stuff like that, they always say, when you are putting the extinguisher, aim it at the source of the fire. Because if you can eliminate there, then you won't have any fire, right? So I think the same kind of analogy we should and say, where is this problem coming from? If we have more issues with community safety and criminal issues, where is this coming from, right? The solution is not more jails. The solution is we need to stop this pipeline. And the pipeline starts in school for some Black youth, right? It's where the school system has been racist to them, and their notion of education has been challenged, and they're no longer engaged with education. And so they have no other alternatives but to. So that's where we should invest more, right? The same thing with hospitals and healthcare systems. Why do we have more people with mental health problems, and they're predominantly Black, and they're ending up in forensic mental health units, right? Does that mean, oh, we're having more people, so let's build more hospital units, right? It doesn't make sense. We have to go back and say, where is this coming from? The root cause is all these disparities, and the common denominator is the anti-racism, anti-oppression, anti-Black racism system that is creating this and, generating all this kind of problems as we go along. So I'm hoping that, with this COVID situation, and then what transpired after that with the George Floyd situation, the anti-Black racism, the Black Lives Movement, where we have seen completely new, and that has not happened in the past, where a lot of non-Black people are listening to this issue, right? If you look at the protests and things like that, it's no longer just Black people going out to protest. We have more people. We have corporations who are listening and saying, okay, we need to do something about this. A lot of people are giving money, and right? So people are listening. And I think COVID, Black Lives Matter, anti-Black racism movement has given us, even though all these are not good scenarios and they're very bad, but they have given us some good opportunity to think differently, to bring about change, and maybe, as I usually say, to shift a little bit and push the needle a little bit towards equity, right? Because now people are listening. People are emotionally attached to say, this is not fair. This is not just, right? We need to do something. And I think if the government can play that role of bringing us together, as you said, communities have good experience doing mobile testing. Okay, they have demonstrated this. Let's work with them, right? So if government, community, and the problem is not just for Black communities or indigenous communities, this is a problem for everybody. If we can come together and with this new notion of we need to do something about this and this is not just, I think we might be able to have a better way of moving forward, right? As you said earlier on, COVID has changed, the new normal has changed, and now this probably will provide us a new way of moving forward and a new way of identifying um, a better way of looking at equity issues, disparities, health, um, education, employment, name it. It's just you need a shift in your thinking, a shift in your approach, willingness to do things differently and plan differently, and engage and work with communities together. I think if that is the lesson that governments at different levels have learned, I think we can be better tomorrow. We can be better tomorrow.
Exactly. That's all very good points. Everything you said, very true. And that's basically why what was the fuel behind this project. This is the last part of our podcast series. We also have a website, which will be issued and made shortly. And we have a research poster project, all these final deliverables. And lastly, we have flyers that will have all these COVID information that we want to distribute to all these community health centers, not just Black community health centers, but community health centers around Scarborough. Exactly. Just to get the word out, try to engage more people. And this podcast really highlighted the reasons why we wanted to research upon this and why we wanted to show the true importance of race-based data collecting and how these inequities in these communities were present before the pandemic. And as mentioned before, in this pandemic, they've been highlighted to another level. And if we can talk about this more, if we can engage more people, as mentioned before, everything you mentioned, if we can get those words out, those points out, and especially all those amazing analogies you've made in this podcast, then we can really make a movement, or at least make some change, make better responses. And I'm glad we had you as a guest today, and I'm glad we talked about all these things because they're all very important. So is there anything else you'd like to add before we end the podcast?
No, I just want to say thank you for the invitation. Thank you for coming up with this idea, right? Because I think this is a good way of passing on information and engaging people in conversations and discussions. This is a systemic problem. It's been there for generation after generation. It's very long-standing, and it's going to require a lot of conversation, discussions, knocking on doors, trying something, not trying something. So this would help us to continue the conversation. So I'm very glad that I could participate in this and contribute to the efforts that you've done. I'm looking forward to all those resources that are coming out, and to work with you guys to make sure that it goes out as much as possible through the different venues we have, the different engagement that we have with communities or mainstream organizations. TAIBU will be very happy to support that initiative and continue to work with you as you progress into your future. So thank you for the invitation. I really appreciate it.
Thank you. So thank you again for listening to our third podcast. Hopefully you checked out the other two as well. They will be all posted on YouTube very shortly, and you'll be seeing them. And thank you to all the community health centers who have helped us in this research project. And lastly, a very big thank you to TAIBU Community Health Center, as well as Mr. Liben Gebremiakel for having the time to talk to us today. And yeah, have a great day and hope to engage more people, and please spread the word. Thank you again. Have a great day.
All right. Thank you.
Thank you.